So the question over here is identify the pathology in the figure. So our options are normal tooth, hypophosphatasia, hyperthyroidism, and dense indent. Let's look at the two images over here. What you're seeing is, so this is the pulp chamber, which is wide, and if you can see, this is the enamel and this is probably the cementum and the dentine, sorry. So the enamel would be somewhere over here. This is the cementum and this is the dentine. So all of this is the dentine. So yeah. So the normal tooth in general, you will see a constriction and then you will see the root. Okay. So first, number one is you cannot see the constriction, cervical constriction. In addition to that, when you see this image over here, what you're noticing is basically that this granular formation. So it's like this. And if you can see faintly, these are the lines. So these are the dentinal tubules, the S-shaped curves. Okay. In addition to that, what you're seeing over here is the Tome's granular layer. Over here, this is the PDL because you're seeing plump spindle shaped cells with nuclei. So these are probably fibroblasts, and this is the PDL. However, after the Tome's granular layer, you are supposed to have a layer of one more layer of mineralized tissue over here, which is the cementum. And that cementum is very clearly missing in this picture. Okay, so the answer is not normal tooth. Dense indent, how would that appear? If this is your tooth, again this is the root. So the dense indent will show another tooth-like formation like this over here. And inside that you will have the pulp canal. So if this is your tooth, this is the dense indent. Okay. And then you have inside this you will find the pulp chamber. So the answer is also not dense indent. So the only two options left is between hypophosphatasia and hyperthyroidism. So hypophosphatasia, one of the key features is there is no cementum formation. In hyperthyroidism, the teeth are completely normal. You do not have wide pulp chambers, whereas in hypophosphatasia, it is the opposite where you have wide pulp chambers. So the answer over here is hypophosphatasia and not hyperthyroidism. Let's look at the explanation. Hypophosphatasia is a rare metabolic bone disease and is characterized by a deficiency of tissue non-specific alkaline phosphatase. This is what we call as TNSALP. This was a NEET MCQ question and we need to know this. Also, this is basically a rare metabolic. So the point is that they are talking about oral aspects of metabolic diseases. So one of the first presenting signs of hypophosphatasia may be premature loss of the primary teeth, presumably because of lack of cementum. As we've seen over here, there is no cementum. You have the Tome's granular layer, but you do not have the cementum that is seen over here. So, caused by a lack of cementum on the root. So this is your first most important key point. This is the second important key point. In the homozygous autosomal recessive form, there are rather severe manifestations, and many of these patients are identified in infancy. The milder forms of the disease are inherited in an autosomal dominant or recessive fashion, appearing in childhood or even adulthood with variable degrees of expression. So basically, all you need to remember is that it is a genetic disease. Okay. Generally, the younger the age of onset, the more severe the expression of the disease. The common factors in all types include the following: reduced levels of bone, liver, and kidney isozyme of alkaline phosphatase. So, alkaline phosphatase is a very important enzyme, and we need to know in which conditions are they increased and in which are they decreased, increased and decreased. So you as students, you need to know the different conditions where they are increased There are about 5 or 6 of them, whereas in which all conditions they are decreased. Increased levels of blood and urine phosphenol ethanolamine. This is another key point. And bone abnormalities that resemble rickets. So what they could ask you in one of the questions is, they could just say that a patient presenting with rickets-like symptoms shows deficiency of this particular enzyme. What is the patient suffering from? In addition to that, one more important key feature of this disease, that rather the three important key features of that is important for oral, dentists is: one is there is no cementum. Because of this, two, there is early loss of deciduous teeth. Three, there is large pulp chambers. And last, there is hypocalcification. All of these are very important MCQs. Thank you.